All right, welcome back, ladies and gentlemen. We appreciate your staying with us throughout the day and learning so much more about issues affecting African Americans. This particular session will be about maternal fetal medicine and the unfortunate circumstances of Black women being 3 to 4 times more likely to die from pregnancy. Certainly dear to my heart as a father and member of a large family with many women and cousins and nieces and nephews, granddaughter as well. This is a very, very important subject, and we're glad to have Dr. Kecia Gaither with us to discuss these important issues. As I indicated, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, according to the Centers for Disease Control and Prevention. Where Black women are also 3 to 4 times more likely to die from pregnancy-related complications than white women, according to the Center for Disease Control. Big reason for the disparity is racism. Black women are not monitored as carefully as white women, and when they do present symptoms, they are often dismissed. So Dr. Kecia Gaither is going to discuss these issues, and she's a double board certified physician in OBGYN and maternal fetal medicine and holds a master's degree in public health. A perinatal consultant and women's health expert, Dr. Gaither's expertise is grounded in both research and her professional experience in caring for women with diabetes, HIV, and obesity in pregnancy. In her current role, Dr. Gaither serves as the Director of Perinatal Services for NYC Health and Hospitals in the Lincoln Division. Dr. Gaither, thank you very much for joining us. Take it away and inform us about these important issues.
Okay, thank you very much for that great intro, and I'd like to thank Ms. Daniels for having me. So with that, I'm going to share my screen and take it away. Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and most inhumane because it often results in physical death." In 1986, the CDC established the Pregnancy Mortality Surveillance System surrounding maternal death. It was a system to evaluate all of the incidences of maternal death. At its inception, the number of maternal deaths was noted to be 7.2 per 100,000 women. Now in 2020, the rate has tripled, with Black women disproportionately affected no matter the socioeconomic status. The cause of the disparity remains unclear. There are a myriad number of factors, inclusive of prenatal infections, lack of prenatal care, and medical comorbidities during pregnancy. While these internal factors are important, what impact do external influences, such as racism and implicit bias, factor into the dismal perinatal outcomes that are prevalent in 2020? This discussion will explore the internal and external forces impacting perinatal health for women of color. As we read the stories across social media, watch TV and film, and listen to the radio, what information has been noted? There is a mounting pandemic of disparate adverse perinatal outcomes among African American women in the United States. Why? At this point, I want to highlight two words: difference and disparity, and ask the question of when does a difference become a disparity? There is little consensus on what constitutes a disparity, or when a difference between two groups should be given the more charged term disparity. For some, disparity implies an inequity or an injustice rather than a simple inequality. Determining when a difference becomes a disparity is not measured directly, but rather as a residual or a distinction between two groups, often only after other factors that might contribute to that difference have been statistically controlled for. So why do I bring up difference versus disparity when talking about reproductive disadvantages seen among African American women in this country? Does a difference exist which compounds the disparities noted? Despite technological advances in obstetrical and neonatal care, Black infants and mothers still experience excess mortality. The mortality rate for Black infants is 2.5 times higher than for white infants. Black women have 4 times higher pregnancy-related mortality and 70% higher hospitalization rates for pregnancy-related complications than do white women. Extreme preterm birth, fetal growth restriction, and sepsis predominantly account for excess Black neonatal mortality. Conversely, vascular, hypertensive, and infection-related complications primarily account for disparity in maternal morbidity and mortality. There are certain experiences embedded within the social context of some Black women's lives: exposure to lifelong stress, unstable relationships, pregnancy unwantedness, substance abuse, inadequate prenatal care, and genetic variables. But when outcomes are stratified across a socioeconomic continuum, the same poor perinatal outcomes still persist. So are there certain pathophysiologic processes or differences at hand accounting for the outcomes? Genitourinary, and to a lesser extent, non-genital urinary tract infections are implicated in preterm birth. Intrauterine infection is the common denominator to what's noted in racial disparities and preterm birth. The exact mechanisms aren't fully elucidated, but it is felt that intrauterine infection results from ascending lower genital tract infections preceding or shortly following conception. Most types of sexually transmitted diseases like gonorrhea, chlamydia, trichomonas, and non-sexually transmitted infections such as group B strep, urinary tract infections, and bacterial vaginosis appear to occur more frequently in Black women. Numerous studies have correlated vaginal infection with bacterial vaginosis to the high incidence of preterm birth. There is a compelling body of evidence that racial differences exist in the vaginal flora or vaginal microbiome of women. A healthy vagina has an abundance of lactobacillus species that work to ward off infectious entities by maintaining an acidic pH in the vagina. Research has shown that Black women impacted by preterm labor show a shift or an imbalance of these helpful bacteria to a more diverse polymicrobial community. This allows for overgrowth of the bad bacteria. It shifts the pH to a more alkaline environment and thus increases the risk of an ascending intrauterine infection resulting in preterm labor or endometritis in the postpartum period. I would be remiss if I didn't touch on this subject. Inflammation, infection, and immunity are all interrelated entities along a continuum which impact the maternal fetal unit. Diabetes, obesity are disease entities common in our community, and it's characterized by inflammation which depresses immunity. Melanin in our skin impacts our ability to make vitamin D. Vitamin D is a vitamin that has a crucial role in heart, bone, mental health, and low levels are associated not only with an increased risk of preterm labor, but in immune suppression. Most of the Black community is vitamin D deficient. Pregnancy in and of itself decreases immune function. to allow the growth and well-being of a foreign body, which is the baby. COVID attacks those with low immunity. So if you're Black, pregnant, poorly controlled diabetic, and you encounter COVID, your chances of death are very exceedingly high. Now this is a busy slide, so for time's sake, let me just summarize it. Pregnancy confers changes of blood vessels and their functionality. This impacts uterine blood flow, and it impacts the blood vessels' ability to dilate or constrict. Black women tend to have higher concentrations of certain chemical substances which have an adverse impact on how the placenta develops, blood pressure regulation, and hemostasis, which is the ability to stop bleeding. So because of that, how does this translate clinically? What do we see? We see a lot of hypertensive morbidities like preeclampsia and stroke and cardiac sequelae. And what you're seeing right here is a picture of a woman who's had several seizures from preeclampsia and bitten her tongue so much that it can't stay in her mouth. So that's what we're looking at. We also see a lot of postpartum hemorrhage and infection. And additionally, low birth weight babies, a lot of preterm birth, and intrauterine growth restriction. Many studies have evaluated the impact of stress during the perinatal period on African American women. Why are we susceptible to gestational stress? Allosteric load is a concept of comprehensive and cumulative risk across multiple physiologic regulatory systems in the body, resulting from chronic exposure to life's challenges or stressors that influence health outcomes across the lifespan. So in essence, it's the body's ability to adapt to stressful events. Weathering is a complementary perspective. It characterizes a framework whereby Black women experience health decrements due to the cumulative effects of stressors like social, economic, or political exclusions involving institutional and individual racisms. Racism has been shown to affect an individual's worldview, self-esteem, feelings of personal value, and it assaults a major characteristic of an individual's basic identity, a characteristic which cannot be changed, like your skin color. So let me introduce the term epigenetics. Epigenetics refers to changes in gene expression due to environmental influences. Research has identified 3 physiologic pathways through which maternal stress results in an epigenetic modification, which impacts your neuroendocrine pathway, meaning the way in which your brain tells your body what to do, vascular disease pathway, and immune inflammatory pathway. A major physiologic marker to explain prenatal stress effects on birth outcomes is corticotropin-releasing hormone. This hormone, via a pathway in the brain and in conjunction with chronic stress, produces cortisol. And as we all know, cortisol is the stress hormone. Cortisol promotes the release of substances from the placenta and fetal membranes called prostaglandins. These cause uterine contractions. Sustained contractions increases your risk of preterm labor. Cortisol, additionally, causes changes in vascular tone and reactivity. Increased blood pressure changes, uterine blood flow changes, resulting in growth restriction in the baby and an increased risk of uterine hemorrhage. Cortisol, additionally, causes impairment in immunity. It decreases the body's defense against infection by decreasing those cells, the white blood cells and the killer cells, which kill off infectious entities in our body. Now add decreased immunity from pregnancy. Add some pre-existing comorbid conditions like diabetes or obesity, chronic hypertension. Add in the vaginal microbiome. Add in the fact that we typically have low vitamin D. now expose us to a virus, coronavirus, which specifically attacks those with impaired immunity. It's a cumulative effect. Let me introduce the term unconscious bias. How do we define that? Social stereotypes about particular groups of people that individuals form outside their own conscious awareness. It's far more prevalent and pervasive than conscious prejudice and often incompatible with one's conscious values. So how does this play out during prenatal care? NPR and ProPublica a while back put out a series on what it's like being Black and pregnant in America. And over and over and over, Black women across all socioeconomic demographics discuss the feelings of being devalued and disrespected by medical providers who equated African American with being poor, uneducated, non-compliant, and unworthy. The women spoke of not being heard, having delays in diagnosis or operative management, or not being offered different therapeutic options. As a result, Black women seem to be less likely to follow up appointments, evaluations, treatments they need, less likely to open up to a doctor who doesn't take their symptoms seriously. Unconscious bias can lead to deadly effects, and the mortality and morbidity rate for Black women during pregnancy and the postpartum period certainly reflect such. So what options do we have for solving the problem? The problem is convoluted, but here are some basic points to take into consideration. Let's prioritize women's health across the life spectrum. Have health insurance coverage and access to primary and behavioral health care from cradle to grave. Whether a woman becomes ill or disabled or dies following childbirth is influenced by her health and well-being before and during pregnancy. Recognize the fourth trimester. That's the period post-birth. That's an important transition period for women. Continue the access to care that meets their needs during this time period. Most maternity coverage ends 60 days after the baby is born. Expand Medicaid. Implement implicit bias training for all medical personnel. Now, granted, we can't change people's hearts. However, the participants are taught to recognize and interrupt their unconscious stereotypes, which influence their actions and which impact their patients' health outcomes. Let's consider changing health paradigms. Opt for some more novel approaches. Group prenatal care models where patients are brought together for health care and there's an educational component to encounters, so the patients get all of their medical, social, behavioral health needs in one place. Let's look at community-based organizations like Black Mamas Matter Alliance. They have a holistic approach to prenatal care for women of color, by women of color. Think about some care partnerships with doulas whose primary goal is to advocate for pregnant patients during pregnancy, during labor, and the postpartum period. Let's talk about screening and dietary modulation. Besides the usual screenings for sexually transmitted infections like chlamydia, gonorrhea, HIV, and syphilis, let's add screening for bacterial vaginosis as a mandatory screening. Assess your patients for nutritional deficiencies, specifically vitamin D. Vitamin D is a vitamin that is very important for melanated people. Ask your doctor to check your levels or get your own kits. There is a great website called nutrientpower.org, which has information on various vitamins, which can allow you to buy your own kits to screen yourself for vitamin D, and also which has an area where you can enlist in research concerning vitamin deficiencies. So in conclusion, there are a multitude of factors contributing to adverse perinatal outcomes for women of color. I've touched on just the tip of the iceberg. The take-home message When evaluating differences versus disparities, keep in mind being Black and pregnant in 2020 is about differences and disparities. Knowledge is power. It's important to break transgenerational influences for poor health. Embrace changing the paradigm of perinatal health care. And on my final note, nutrition plays a vital role in maintaining and enhancing immunity, particularly in the time of COVID. Eat foods which enhance your immunity. And remember, vitamin D does a body good. And with that, I thank you. I'll take time for questions now. Okay, let's go into the chat room. Oh, great. So thank you to Suzanne Frank. Thank you to Dawn Shelton Williams, Shantana Hazel. Is the bias really unconscious? Yes and no. I will definitely say that from anecdotal experience. Is there a limit on how much vitamin D you should take? I usually tell my patients to take 1,000 IUs a day. Environment, pollution, and climate control, they're also significant factors. You're absolutely right. However, I only got 20 minutes to talk about stuff, so I just gave you the missive. Okay, what vitamin dose? What do you suggest for the poor level of screening for perinatal and postpartum depression among Black women? Well, in most hospitals, when the woman comes in for prenatal care, there is a screening done by social work, and there should be a number of questions that are posed to the patient to find out whether or not they're suffering from perinatal and postpartum depression. Can I talk more about vitamin deficiency and how it relates to melanin? Vitamin D is made in the skin. Melanin blocks the production. People who are of a hue tend to have lower levels of vitamin D simply because of that. Vitamin D is made in conjunction with the sun. So it's very helpful not only for people of color to get in the sunlight such that more vitamin D is made for their bodies, but also to take supplementation, particularly when they're pregnant. Are there any organizations we can support to help with the maternal mortality awareness? Well, that's interesting, you should say. I am currently involved with a number of organizations, primary of which is the Association of Black Cardiologists. And we have supported a number of legislators, namely that are involved with addressing maternal mortality. There are 2 legislators in particular who have a momnibus. They've submitted a number of health bills to address maternal mortality as it relates to women of color. What are the benefits or functions of vitamin D? Vitamin D is a crucial vitamin that's involved in a number of body functionings. It's important for bone metabolism. It's very important for heart health, for your mental health. Low levels are correlated with an increased risk of preterm labor. It's certainly very much important for maintaining your immune function. What was the website to check vitamin levels? It's www.nutrientpower.org. GC stands for gonorrhea. In many hospitals, childbirth education classes are not mandatory, they're voluntary, but that's certainly a consideration to make them mandatory. Thank you so much. Is sunlight more effective than taking a vitamin D pill? Well, in the time of COVID, when we're sitting in the house away from sunlight, I think that we need to have a little bit of both. Do I know of any culturally relevant screening tools for perinatal depression? I don't think that that has been extrapolated. I think there's pretty much one screening modality that is used. What other supplements besides vitamin D do I suggest for immunity? Vitamin A, vitamin C are very important, and take your omegas. Omegas you can get in fish and green leafy vegetables, as well as your prenatal vitamins, which you have a supplement. Being that many inside their homes due to the pandemic, do you advise to take additional units of vitamin D3? Yeah, 1,000 to 2,000 units, particularly if you're in-house. Okay, I think that I've tried to answer many questions. Is the result for Black patients better with a Black physician? I think you know the answer to that. I personally would say yes. We can relate with each other. I think there is, you know, more of understanding where the other person is coming from, but that's my own opinion. Can you think of any related legislation we can advocate for? Adequate health coverage, coverage for contraception, coverage for the 4th trimester. Thank you very much for all of the compliments. What advice do I have for young Black women preparing for childbearing years? Whatever comorbidities you have, if you have diabetes or hypertension, I think it's really important to get whatever comorbidities you have under control. Particularly for diabetics, it's really important because high blood sugars can give you a lot of complications in pregnancy and can cause a lot of congenital anomalies for the babies that are specific to diabetics. It can impact the baby's brain development in a bad way, their heart development, and they can have an abnormality where their lower limbs fuse, and that's called a mermaid baby. The official name is serranomyelia. So to prevent any adverse outcome impacting your pregnancy and your baby's development and growth, it's best to get your comorbidities, particularly diabetes and hypertension, under control. Additionally, I usually recommend that my patients take a vitamin supplement with folic acid. Folic acid helps to ensure that there's normal brain development. Lack of folic acid is associated with abnormal brain development. What can be done at the medical school level to address these concerns and disparities? It's interesting that you should say that. Certainly when I was coming through medical school, there was nothing. I would encourage those that are in medical school and in training to join the National Medical Association they have a branch called the Student National Medical Association. Certainly you will be immersed in not only educational opportunities within the Student National Association, but you'll get to meet physicians across the country, Black physicians throughout the country and in Canada and from the islands at the regular meetings. You will develop certainly a collaborative type of spirit of things. And I think that would probably be the best advice that I can give. I certainly did that. Because you're not going to get it in medical school to that extent. Okay, please give the website for health supplementation one more time. That's www.nutrientpower.org. Or you can just check my website, www.KeciaGaither.com. Got a lot of stuff on there for pregnant ladies. Why is acupuncture never recommended to help control stress and comorbidities? Well, you know, a lot of physicians are not into Eastern medicine. You know, I kind of like to take a holistic approach, giving respect to Eastern medicine, but also employing the best of Western medicine. I think that acupuncture is actually a very helpful modality. And certainly it does help with controlling stress and a lot of other things that go on in the body. So I am not one that's going to discount Eastern medicine, because there's something to be had with all aspects of medicine. How can we prevent vaginal infections? Well, as I said, there's a particular bacteria called lactobacillus that's in the vagina that keeps the bad germs out. Lactobacillus is also found in yogurt. So if you don't like yogurt, if you don't like yogurt, there's also a pill called acidophilus. Acidophilus has lactobacillus in it. So one or other of those modalities help to keep your vagina's pH balance in check and keep the good bacteria there. Thank you. Let's see. Don't prenatal vitamins have all the vitamins? Not necessarily. Do I practice holistic medicine? I wouldn't say I practice holistic medicine, but I'm very cognizant of it, and certainly, discuss it with my patients as alternatives to certain things. I wouldn't say all, but to certain things. I am of the mindset to try and try a holistic approach before we start going with medications. I mean, a perfect case in point is if a woman comes in with protracted nausea and vomiting, I think we need to try ginger before we go on to some type of medication. For those of us that have other comorbidities like sickle cell anemia, do you have any additional advice? I think it's important that you keep in contact with your hematologist. I think it's important that your blood counts are kept up. And certainly during pregnancy, you're going to be monitored quite frequently because sicklers tend to have smaller babies. So you're going to be monitored for fetal growth, and you also have an increased risk of having some hypertensive issues during pregnancy. So if you're a sickler, you need to be under the care of a perinatologist. Can I repeat the website? www.nutrientpower.org. I'm a certified personal trainer. Do you feel physical activity would help decline the deaths among Black women? Yes. It decreases obesity. It certainly improves cardiovascular function. So I think that would be a wonderful thing. I don't know, am I still on? I'm recording.
You are still on.
I am still on, okay. All righty. I have a lot of questions, wow. How often do you recommend screening for BV in pregnancy? Every trimester. Can you take vitamin D, probiotics, and iron supplements at the same time? I would ask my doctor about that. Ask him to take a look at the probiotics because not all of them are the same. So definitely you're going to be on iron supplementation. And if you're coming to see me, you're going to be on vitamin D. You're going to be screened and placed on vitamin D. But the probiotics, not all of them are the same. So it would be helpful for your doctor to actually take a look at what it is that's in it, to make sure that there's nothing else added that would be harmful. Oh, wow, lots of questions. Would screening for anxiety help to indicate how well a pregnant woman is handling external stressors? Yes, absolutely. And typically at the beginning of their entrance into a prenatal care facility, there's always a social work interaction to ask for these particular questions to see whether or not there's an issue or not. So that would definitely be helpful. What's the best way for healthcare providers to be cognizant of those biases? Watch how they interact with patients. Watch how that's the easiest way. Just watch how they interact with patients. Do they ignore them? Do they blow them off? Are the patients heard? Where am I located? I am the director of maternal fetal medicine at New York City Health and Hospitals, Lincoln in the Bronx. How about increased calcium? Absolutely. Calcium and vitamin D are very important for bone development, for baby. Okay. Wow. A lot of questions. I wish I had more time. I've dealt with anemia all my life and was not expected to carry my child to term, but I did. Any advice for dealing with chronic anemia besides iron pills? Well, it depends on what kind of anemia we're talking about. Are we talking about iron deficiency anemia? What kind of anemia are we talking about? If you're talking about iron deficiency anemia, there is, you can get IV iron such that you don't have to necessarily take iron pills. So that's an option. But if it's another type of anemia, like a megaloblastic or something like that. So, what is your take on long-term hormonal birth control use? Depends on how long we're talking. Would you say that obesity and stress would be the two things women should address and a lot of other chronic diseases are improved? Well, obesity is basically another pandemic in our community. And obesity leads to a whole lot of things that really cause a lot of problems. Obesity increases your risk of diabetes, of heart disease, of limb problems. So I would definitely say, let's really take a look at what we're eating. Let's do some exercises. Obesity decreases your immune system. So the worst outcomes that I've had during this COVID crisis have been with obese, diabetic women who are poorly controlled. So yeah. I don't have a private practice. I'm at New York City Health and Hospitals, Lincoln in the Bronx. How to address obesity in a way to not cause Black women to become defensive. Well, I think that I know that she did, Dr. Fergus discussed certain things that she has made. Among them is a cardiovascular cookbook. She and I have established a program at Lincoln looking to address things that cause cardiovascular malfunction. And obesity is one of the things that we address. So, I'm not thin, just kind of have a frank discussion, like you're talking to your friend, like, I think, there might be a methodology to kind of decrease the weight because the weight can do X, Y, and Z. I mean, it doesn't have to be in a mean way, but, just kind of talk to your patients about what obesity does for them. Obesity may be related to adverse childhood experiences and social determinants of health. Absolutely. Keep in mind, we are taught to eat from our parents. So if your parents are, eating in a way that produces obesity, 9 times out of 10, the child is going to have those same eating habits. It's a transgenerational thing. So when I talked about, having transgeneration, knowledge is power, and having a transgenerational thought pattern, who you are and what you eat gets transmitted to the next generation. So you're obese, you have high blood pressure. Your child is going to be obese, have diabetes. I mean, so when you're thinking about your life course, that's really something to think about because transgenerational effects are real. Am I still on?
You are still on. Would you like to answer like a couple more questions and then end or
What's
end now?
my name again? My name is Dr. Kecia Gaither.
No, I said, would you like to continue answering a few more questions and then?
Oh, sure, I can answer. I'm reading them as they come. Somebody just asked what my name was again.
Oh, okay.
So I said Dr. Kecia Gaither. Wow, I got a lot of questions.
Oh, I think they want you to wrap up right now.
Okay, so how do I do that?
I will end it for you. You can just say your goodbye and then I'll end the meeting.
Okay, this was wonderful. Thank you for the questions, everybody. Again, if you want to get to know me a little bit better, I have a website, www.keciagaither.com. Thank you, Ms. Daniels, for inviting me. This was really a blast. This was wonderful. So to all my ladies out there, be safe. Take your vitamin D. Thank you.